Urban Rural Action is a national nonprofit organization that partners with communities across the United States to foster the community strength and resilience necessary to address our most urgent challenges together. Their cross-partisan civic participation programs bring together individuals from different ideological backgrounds, racial identities, generations, and geographical locations, among other differences. We believe that true community strength emerges from a genuine relationships, enhanced collaboration skills, and a willingness to explore differing viewpoints on critical societal issues. By working hand in hand with local community organizations such as Suicide Prevention of York, we collectively address urgent challenges that impact the well-being of our communities.
One significant initiative is with our Urban Rural Action Team in York, Pennsylvania, partnering with Suicide Prevention of York, focusing on having a safe and strong community. This team is focused on a deeply pressing issue, the incidence of suicides across all age groups within York County.
Our project's ambitious yet vital goal is to achieve a measurable reduction in these incidents, thereby saving countless lives. To accomplish this, we are developing and implementing videos on various social media platforms of individuals who are affected by suicide and suicide attempts.
Our aim is to equip individuals, families, and community leaders with the knowledge, resources, and support systems necessary to identify warning signs, encourage open conversations about mental health, and facilitate access to professional help. We urge everyone to view, share, and like the videos, and to pass on to anyone they know who might be struggling with suicidal thoughts. Encourage them to engage with these materials, and most importantly, to seek professional assistance is a vital step in our collective effort to save lives and build a more supportive community.
A lot of times it's not what you say, it's what you do and listening. I think listening is key. You let people who are suffering kind of take the rein because it's empowering to them and it's also healing for them to be able to share because it's very personal, your pain. My name's Lucy Cadwallader, and I lost my son Daniel to January 18th, 2010. As a result of his loss, I decided to join the compassion and care team with the York County Coroner's Office, where we reach out to families who've lost loved ones. I deal mainly with the suicide, the families who've lost loved ones by suicide. We started seeing signs at around age 13. You know, the darkness, self-harm, things like that. And he was in and out of facilities for years, contemplated suicide, many attempts. He told me every day is a struggle. You know, although none of his close friends even knew that he suffered with depression, because he was usually the one who brought them up while he was hurting inside. So, well, I found him. So I think at first you're kind of going through the motions and I was in shock. I just couldn't stop crying. I think it was about a year and I realized I'd gotten through a day without crying. You know, and we're not talking a few tears till your stomach is hurting and your muscles hurt. I had a lot of help from my family, you know, just calling me at the time that he had passed and each day to just check in, make sure I'm okay. My daughter, who was in college at the time, was a huge help. She worried about me, I worried about her. There were times when she'd touch base with me, and one particular incident was I got lost and I was only a few miles from home, and she didn't make fun of me, didn't laugh. She just went, "Where are you?" You know, describe where you're at, what's a landmark, and got me safely home. But it's that grief cloud that you're in, you're not thinking straight. So between that and just each day getting up and trying to get through it the best I could really helped me. I had even my own husband saying, "You're not like yourself." I'm like, well, I'm not ever going to be that old Lucy, prior to his passing. I'm a different person now because I was pretty happy-go-lucky, and it's not that I internalized it all and became depressed myself. I focus a lot with the survivors in stating your loved one's not going to want you to live out the remainder of your life living like they did, with that depression and gloom and not experiencing life's gifts. One thing in particular that helped me was just getting back to nature. My son was an avid photographer. He loved it. He went to the Art Institute of Philadelphia. He befriended the homeless, so much so he'd invite them in for dinner and a movie in his room, unbeknownst to his roommates. That's just the kind of person he was. I took a class in photography using his camera to learn it, and just appreciating nature and something that he had left me, with his photography, his photographs. It took time. It's a hard thing to let the survivors know, but I tell them days do get better, but you have to give yourself time to heal. Prior to Daniel's passing, we did Civil War reenacting, and very much involved in Victorian history. The Victorians, at the time of death, took death to a whole different degree. And we were just talking about this at one of the support groups, that at the time of death, the Victorians, one of the first things they would do upon death is stop all the clocks in the house. And I thought that was extremely profound. I thought about that, and I thought, time does stand still. My motto early on in my grief for Daniel was every day, every hour, every minute, every second sometimes. And I thought, if I got through that, I can get through the next. And it was a struggle. I didn't eat for 3 months. I just could not bring food to my mouth. The whole thought of it was just too much. Even getting dressed in the morning, putting an outfit together. My daughter, I still have it on my dresser drawers. She'd label what outfits would match. I mean, I laugh at it now and giggle, but they're starting blocks. You have to start with the baby steps and rebuild yourself to be kind of who you were, but not the same. You're going to make changes because you've had a terrible loss. And I look at it and go, I've come a long way, and build it from there. That's where I come in with the compassion and care team. That's really helped me a lot in knowing I'm helping others, but also it's helping me. Is it hard? Yeah, it's very hard to take myself back to those early days, but I see how far I've come, and not being a poster child, but I'm an example to those who are struggling, going, well, she looks like she's kind of getting her life together, and I have, and I want people to know, survivors to know that if there's help out there. If you want it, if you don't, that's fine too. There's other avenues. And I told many people this, if you're not harming yourself or others and it's working for you, that's fine. I reach out to survivors, and people have asked me, well, did you want to end your life when your son did his? And I said, yeah, I thought about it. It never became a plan. I didn't take it that far. I said, but sure, you want to join your loved one. You're hurting that deeply, and you can't think of the next day to come because you're stuck in that pain. But if I came across somebody who was hurt, number one, I would not leave their side till I got them help, and just understanding and letting them know that it's a normal feeling, but also just kind of pull out of them just how far they've thought this through. If it's a fleeting thought or if it's something that they are giving, a lot of planning to, because that's when you need to kind of step it up and put a whole different twist on things and let them know that you care. I would share from my own experience of what my son's loss has done to our family, the ripple effect, his friends, and so on and so forth, but more so making it about them and wanting to know why, and that whatever problem they're having, we're going to, work on it together, and just, again, not leave their side. It's forever. That pain is always there. And I don't sugarcoat it for people that I speak with, because they're like, does the pain ever stop? I said, no, it doesn't. It lessens from time to time. Well, how do you do it? How do you get through a day? And I have a great word for it. I compartmentalize my grief. I put it aside until I have time, maybe at the end of the day or in the car, where I can mull it over in my head a little bit and think about it more clearly than in the moment. And that takes a while. Probably with me it was years before I could do that comfortably, because we all have our bad days, anniversaries come up, or I see my grandsons playing and knowing Daniel's not part of their life. That's a hard thing to accept and to see. And but I feel his presence and his presence around them, and with that I've been able to, I guess, have a little more peace in my life and not let that overshadow the pain. And I can't bring him back, so I try to make the most of his memory and do the best I can with each day. I feel very fortunate to have those 23 years with him. I knew a lot of those years were a struggle for him, and I feel like he kind of stuck it out as long as he possibly could. One thing and it kind of plays into this, what I asked all the young people at his funeral, I said, if you all wouldn't mind, would you all, when you have the time, granted this was back in 2010, I said, I'd like snail mail of a funny story or what Daniel meant to you. And I go back to those, and some of them are hilarious, of the antics, teenagers and middle schoolers. He was a good kid. He was caring, he's witty, extremely intelligent, probably too much so sometimes. I loved his art and how he expressed himself through his art. And it's a shame that he didn't have the time on this earth to experience that further, especially where everything's going now. I feel him around me, but he's just not physically here. And that's a big comfort for me.
Thank you for staying with us and watching this video. If something you've heard has struck a chord in your heart or in your mind, and you'd like to learn more or talk with somebody about some of these topics and issues, we encourage you to reach out to one of the many organizations that we've listed. They focus on helping people with this subject. Many of themselves have experienced these very same concerns. If you know anyone who may find this video beneficial, please share it with them and encourage them to have a listen, or even better, listen to it with them. Thank you very much.